Do you frequently feel like your heart aches sometimes, especially after a sore throat that just won't go away? Or maybe your knee suddenly swells and hurts for no clear reason. These might not just be random issues. They could be signs of something called rheumatic fever. Imagine your body's defense system, the immune system, getting confused. It fights a throat infection, but instead of stopping, it accidentally attacks your own heart, joints, or even brain. That's what happens in rheumatic fever. It mostly affects kids between 5 and 15, and it can sneak up weeks after a simple sore throat. Think of it like a delayed reaction. Your body wins the battle against infection, but starts fighting itself afterward. So what causes this mix-up in your body? It all starts with a tiny bacteria called Group A Streptococcus, the same bug that gives you strep throat. Let's say your friend has a very bad sore throat and doesn't take medicine for it. If left untreated, this bacteria can stay in their body and trick the immune system. Your body makes antibodies to fight the bacteria, but these antibodies mistakenly attack healthy tissues like heart valves, joints, or skin. It's like sending a guard to stop a thief, but the guard starts damaging your own house by mistake. This only happens in some people, usually those with limited access to health care or living in crowded areas, because untreated strep throat is the root cause. Now, how do you know if someone might have rheumatic fever? Let us play detective. Look for fever that will not go down painful and swollen, joints especially in knees, elbows, or ankles, that move from one joint to another like a traveling pain. Some kids start moving their hands or face uncontrollably, like they cannot control their movements. This is called Sydenham's chorea. Others might get a pink rash with odd edges like a snake on their skin. And the scary part, heart issues. Imagine feeling tired quickly when playing football or breathing fast for no reason. This could mean heart damage. These signs usually show up 2 to 4 weeks after a sore throat. If you notice this pattern in a child, it is not just growing pains, it might be rheumatic fever. How do doctors find out for sure? There's no single test. Instead, they use a checklist called the Jones criteria. Think of it like solving a puzzle. One piece from heart symptoms, one from joints, one from lab tests. The doctor will ask about recent sore throats. Check your heart with a stethoscope for weird whooshing sounds, called heart murmurs. Take blood to see signs of past infection, and sometimes do an ECG or echo scan to see if your heart is working normally. Treatment has 2 main parts. First, kill the bacteria with antibiotics, like penicillin. Even if the sore throat is gone, we clear out any leftover germs. Second, reduce swelling and pain with anti-inflammatory medicine. If the heart is damaged, some kids need long-term care, like monthly penicillin shots to prevent future attacks. It's like fixing a broken car and then giving it regular tune-ups so it doesn't break again. Can we stop this from happening in the first place? Yes, and it starts with treating sore throats the right way. Imagine your little sister has a very red throat and fever. Instead of just giving her tea or rest, you take her to the doctor. If it's strep throat, 1 course of antibiotics can stop rheumatic fever before it begins. This is called primary prevention. For kids who already had it once, they may need monthly penicillin shots for years, even if they feel fine. That's secondary prevention, like wearing a seatbelt every time you ride a bike, not just after an accident. Simple actions like good hygiene, washing hands, covering coughs, and better healthcare access in schools or villages can save many children. Now what's new in this field? Scientists are working hard to make things easier. Right now, diagnosing rheumatic fever is tricky because it relies on symptoms and history. But new research is testing a simple blood or urine test that can flag the disease early like a smoke detector for your body. Also, some teams are creating longer-lasting penicillin shots, maybe once every 6 months, instead of every month, to help kids stick with treatment. Others are studying genes to see why only some people get this after strep throat. Imagine using AI to predict who's most at risk, just by looking at health records. These advances could one day stop rheumatic fever completely, especially in poor or